Everyone entering the healthcare system experiences stress. Maybe you've had the experience of being hospitalized, having surgery, or have a loved one that's been admitted to a nursing home. All these experiences elicit a stress response. Hi, I'm Kathy Getrist, and today we're going to be talking about client and family stress. There are multiple causes for stress when someone enters the healthcare facility. Some of them are the unfamiliar environment that's in the healthcare facility, losing control over one's schedule. Think about it. No longer do you determine the time that you're going to be getting your meals. All of the different diagnostic tests like x-rays and lab work are done at a time that is certainly out of your control. Being dependent on others for care can also be very stressful. When you're used to caring for yourself and suddenly you've been hospitalized for surgery and require assistance to get out of bed, go to the bathroom and such, it's a very difficult time to feel so dependent. Also, it's stressful to be worried about family back home and what's happening in your absence or the absence of a patient. Uncertainties about the future. Many times people have illnesses that they're not sure how it's going to turn out, and they're concerned whether or not they're going to live, whether they're going to become well again, and is very stressful. And of course, we all know about the tremendous costs of health care these days, and so financial concerns is also a very large area of stress. Most people just don't have the energy to cope very well with numerous changes, especially when they're ill. When any person feels unable to cope with stress, we tend to act in a protective way. These ways are called defense mechanisms. For example, a diagnosis of cancer may be so overwhelming that a person must temporarily defend themselves against acknowledging the truth, and may not seek treatment, may ignore it for a period of time just because acknowledging its reality is too much for them to be able to handle in the beginning. We all use defense mechanisms. Think about a time when you might have been approached by someone who's angry with you, who feels that you've done something wrong. Our immediate response is, not my fault, I didn't do it, and it's a way to protect ourselves. We must recognize and understand the need to use defense mechanisms. Defense mechanisms are needed until our brain, our body, our being is able to come up with some less radical strategies to be able to cope with stress. Defensive behavior, however, can become harmful if it is prolonged and it goes on for a long period of time. In some cases, persons continuously avoid recognizing and responding to the reality with doing some problem solving. Think about a person who's been given the diagnosis, or a loved one the diagnosis of Alzheimer's disease. In the early stages of that disease, the individual, if they acknowledge the diagnosis, can begin to make some plans for the future when their mental faculties and physical faculties will begin to deteriorate. If they refuse to acknowledge the reality of it and continue to be defensive, it's not going to be a good thing long term. Person's stress is temporarily reduced, but the root of the stress is not, and they require therapy from professional mental health workers. There are some commonly used defense mechanisms I'd like to talk about. The first is repression. Repression is the burying of a painful thought or memory. An example might be a person burying the thought of a sexual assault that they might have had in a childhood, or a very traumatic, violent experience such as a car accident. Suppression differs from repression in that the person is aware of the unacceptable feelings or thoughts, but deliberately refuse to acknowledge them. Example might be a woman who has found a lump in her breast, ignoring it and refusing to seek medical attention. She's well aware that it's there, but can't mobilize herself to actually seek help for that at this point. Projection. A person's own unacceptable feelings and thoughts are attributed to others. Example would be a person who has an alcohol problem and instead attributes it to his wife for the loss of his job. In other words, his failing is being projected onto his spouse. Denial. The blocking out of painful or anxiety-producing events or feelings. This is one of the most common defenses that's used when there's a new diagnosis of illness. Example might be a person who's been diagnosed with high blood pressure may refuse to lose weight, stop smoking, and adhere to some other recommendations made because the fear of the disability and the possibility of having a stroke because of the high blood pressure is just too much, and so choose to not accept the seriousness of the condition. Reaction formation. A person using this defense mechanism represses the reality of the situation and then behaves exactly opposite to it. For example, if a person has, let's just say a patient dislikes a nurse that's caring for her, and she's afraid to express her feelings to the nurse for fear that the nurse will take it out on her, she instead just does the opposite with the nurse. She behaves very cooperatively and she's very nice to the nurse. Displacement is the last behavior defense mechanism that I'll be talking about. It's substituting an object or a person for another and behaving as though it were the original. A nursing assistant, for example, may become very angry with a patient when in fact that nursing assistant really has angry feelings towards another caregiver. In that instance, there is a displacement of the anger from the co-worker onto the patient. We need to assist clients to cope. The first and most important thing is to be a good listener. Try to determine the source of the stress. It may be something that you can deal with. If not, certainly report it to the nurse. Be sensitive to nonverbal messages, or what's called body language, to be able to determine whether or not the person is experiencing a great deal of stress. Their body posture may be stooped. They might have hand wringing going on. Their foot might be tapping. Their activity level might be lowered. They may want to stay in bed. They may be refusing to get up and participate in activities. Facial expression might be one of anxiety or anger, or might be crying. And their overall appearance might give you the impression that they're not dealing very well with stress. Treat the individual with respect, recognizing them as a unique being. Try to understand the behavior in the same way that the client is. In other words, try to walk in their shoes. Let the patient know that you are reliable and that you respect their feelings, and so the patient can learn that even if he or she lashes out, you're still going to be there for them. Never argue, enter into a power struggle, or debate with a client, even when you know they're wrong. This will do nothing other than escalate the stressful experience that the patient is having and will prolong their journey towards wellness. Also, be supportive of the person's own attempts to overcome stress and give them encouragement when you see efforts working in that manner. Maladaptive behavior is acting out frustrations and stress in a negative